definitely an area
That's
where
why I
it
mentioned
is,
that, because
it is possible for us to have the corpus of data that is needed to develop models, which would be
fact,
important for us and also for the rest of the world.
Speaking of health, Arvind Aikar, a Harvard Business School professor, was visiting a couple of days ago. I think he was in Bangalore yesterday too. He mentioned that Arvind Aikar is not just the best in India, it's the best in the world. Best in the world. He said he's been a Harvard Business School prof for 40 years. He has studied these questions. So in healthcare, particularly delivery, we have an intrinsic edge because of the volumes involved, the variety of patients our doctors see, all of that. That could actually lead to, again, domain-specific models. Maybe the 7 billion parameter model applied to eye care and applied to cardio. All of these problems could yield faster dividends for us. That's why I mentioned that.
I was, in a meeting in New York last week, Thursday, Friday, where Meera from OpenAI was also there. And an interesting conversation is that in the US, there is a peculiar way of unlocking the data sets from, let's say, a hospital to a modeler. Let's say one of you here is Vivek and Bala sitting here, so I'll pick on Vivek. And Vivek wishes to develop a model. He goes to Tata Memorial Hospital. They're willing to give him an anonymized data set. Now it's very important that Vivek or his team members keep it anonymized, because if it de-anonymized, there's a reputational damage to Tata Memorial Hospital and, of course, a financial damage because they have to pay very big fines. So there is a mechanism that you need to ensure good behavior. In the US, that is done by a legal system, and that legal system basically has very large indemnity payout if there was bad behavior on the hands of the training data consumer, the person who's received that data. Those contracts are easily enforceable in the US, not in all parts of the US, but certainly in New York law. And so that allows them to allow for this collaboration to happen easily. Now, when you go to Canada, you are not able to do that, right? So Canadian companies, you hear this screeching sound. Every week you hear one more Canadian company re-domiciling itself to the US, because that is their only way to be able to access the continental-sized data sets that are available in the US. You can't do it in Europe. Anglo-Saxon law generally doesn't allow it. French law doesn't allow it. In India, it's not just a legal problem, it's also the efficacy